Well, hello everyone, and thank you for being with me. My talk is Healthy Birth Initiatives. We experience what they experience, reflections on providing culturally specific perinatal health care. I'm presenting on behalf of my research team um, of my colleagues in the School of Social Work, doctors Gita Meotra and Suzanne Clawetter. Um, and this is me, this is Suzanne, and this beautiful person is Gita. And we are sharing findings from some focus groups that were done with Healthy Birth Initiatives, and I'll explain more who they are. Our research is we are working to we are centered around Black maternal health. That's our that's how we enter this work. And the racism pandemic in the United States, Black maternal and infant health outcomes compared to non-Hispanic whites. Overall in the country, Black birthing people have a 2 to 3 times higher maternal mortality rate than white people. Depending on where you are in the US, that number can go up to even 11 times higher. I think I heard that out of Missouri, with increasing reproductive oppression, with restrictions on abortion, contraception access, and limits of accessible and good reproductive health care. We find that Black women and Black birthing people are, that our exposure to adverse outcomes in birth is increasing, not decreasing. We also recognize that in the US, our overall reproductive health outcomes are worse than that of other developed nations. In the US, Black women or Black birthing people are 2 times more likely to have low birth weight babies, 60% more likely to have preterm birth, and that preterm birth is a baby born before 37 weeks gestation, and more than double infant mortality rate. If you want to think about the health of a nation, it's useful to look at what is the percentage of babies that make it to their first birthday. Black and white maternal mortality disparities widen with educational attainment. So in the US, for Black birthing people, the more education we have, and even the more financial resources we have, the greater chance we have of having adverse health outcomes. For white birthing people, the older they get, the more education they have, the more money they have, the better their birth outcomes. Infant mortality disparities persist when controlling for socioeconomic positions. So the problem in the US is not the Black body. The problem in the US is racism and the ways that Black birthing people are treated and the ways that Black babies are treated when they move into healthcare settings. One of the other things that we also know is that for Black birthing people, we have better outcomes and our babies have better outcomes when we are treated by Black doctors, and not particularly because Black doctors are different to white doctors, but because the ways that Black doctors are engaging with Black patients is more attentive and attuned to the needs of those patients, which catches changes in health status that may be life-threatening. Racism-related stress is a phenomenon that is chronic stress is associated with experiences, anticipation, and responses to racism and discrimination, and dynamic interactions that occur between people and their environment over a sustained period of time. Repetitive stress associated with racism may drive the body to its allostatic load, marked by an inability to recover from the damaging effects of stress. So when we're thinking about Black birthing people and adverse health outcomes, one of the impacts of racism-related stress on Black birthing people is that it weathers the body, that it ages the body, and that chronic stress exposes the body to weakness and to disease. Some stress in one's life is good, right? Like some stress kind of encourages you to actually like get up and do the things you got to do. But chronic stress, which is a low level and at times acute stress, puts the body into a place of distress that is dangerous over time. Reproductive justice, a framework that was developed in the 90s by, it was initially developed by Black women and grew to be embraced and developed by women of color and LGBTQI community. And reproductive justice, it advocates for people to have the full range of reproductive options and centers people's lived experiences. It insists on dignity, autonomy, and choice. Reproductive justice is it's based on human rights and a human rights framework. It is intersectional, and it is about body sovereignty. Reproductive justice challenges reproductive oppression, which are laws, practices, policies, and beliefs that limit people's and communities' control over their own bodies. With reproductive justice, it is the right to have a child, to not have a child, to parent the children we have, free of state and community violence, and control over our own bodies. So healthy birth initiatives. Healthy birth initiatives, I live in Portland, Oregon. I live in Multnomah County. And in Oregon, Black people make up, I think we make up 3% of the state population. In Portland, we make up 11%. Is that right? No, we don't make, yeah, no, we don't make 11%, sorry. In Portland, we make up 7%. And Multnomah County is where Black folks in Oregon are most concentrated, though we are also moving to our surrounding counties because we can not afford to live in Multnomah County. And Multnomah County was, not Multnomah County, Healthy Birth Initiatives was developed 20 years ago as a nurse-family partnership. It was developed by Black folks who wanted Black nurses and Black community health workers to serve Black birthing people. And home visiting programs are one way that people are addressing major maternal health disparities. HBI meets with a nurse or a community health worker, meets with a Black birthing person monthly or more during their pregnancy, and can go with them to their doctor's visits, helps answer medical questions, assists with lactation and nursing, and they stay, your nurse or your community health worker stays with the new parent and their baby up till 18 months after the birth. People who participate in, and some of the services that they provide, so Healthy Birth Initiatives is both a nurse family partnership where you have the nurse or community health worker coming to your home and working with you, but they also provide some social services like transportation, goal planning, respite care. They provide family planning, some mental health support, and they work to bring fathers into the process, childbirth classes, some parenting classes, leadership development, and advocacy. And the advocacy that Healthy Birth Initiative does is with doctors and health systems, as well as with social service organizations like Child Protective Services, to raise awareness around the ways that Black people may be discriminated against within these systems, the ways that racism and classism and sexism impact how Black families are perceived and treated, and to ensure that more Black families remained intact through the experience of pregnancy, birth, and a child's first years. So among, this is from some of the work from HBI, some of their studies. They found that from the period of 2009 to 2013, infant deaths per 1,000 births, HBI infant mortality was 3.14. The rates for whites in Multnomah County infant mortality was 4.5. The rate all in Multnomah County was 8.2. So 62%, HBI has a 62% lower infant mortality rate than for African Americans who are not participating in HBI, which is amazing. Low birth weight, so 2.6% of HBI participants have low birth weight babies. 11.3% of African Americans not participating in HBI have low birth weight babies. So one thing to know about low birth weight is that as young people, as babies, you want your baby to be, to be a healthy weight. You want your baby to not be too heavy from gestational diabetes, or you want your baby to not be too small from either prematurity or largely from prematurity and other health complications, both either being low birth weight or growing too fast in the womb, both contribute to long-term health health issues. So this study is, we did a focus group, a series of focus groups, but this particular presentation is centering the experiences and voices of HBI nurses and community health workers. This was done, a focus group was done in 2019. And the key research questions that we had were, how do Black women describe the experiences and impacts of racism-related stress as it relates to pregnancy, health, and parenting? How does HBI mitigate the impact of racism-related stress on clients' pregnancy, health, and parenting? And what is the shared impact of racism-related stress on Black women's health between HBI staff and former HBI clients, as well as the lasting impact of the HBI intervention in building resiliency among Black women? And within this study, all of the participants identified as women. We are using a Black feminist way of knowing. We had 7 participants. We had HBI current nurses and community health workers, and 1 staff working directly with pregnant people. We talked with them for about 80 minutes and did a thematic analysis. We found that shared lived experience and parallel processes between providers and clients, that Black birthing people and Black nurses and community health workers were very much experiencing similar things. That for HBI staff, they're navigating multiple gazes. They're navigating the gaze of clients. HBI calls their patients or their people on their caseload clients. So they're navigating the ways clients view them. They're navigating the way public health, that they are located within the Multnomah County Public Health Department, how the Public Health Department views them, and when they are advocating for clients, they're navigating how medical systems view them. Sometimes they are viewed positively, sometimes they are viewed negatively, but they are always viewed through a racialized and gendered lens that is at times anti-Black, and that they are doing that while advocating for others. That as HBI is doing its work, it is holding reproductive justice and community care as a culturally informed approach to their work. So when they're thinking about how to engage with their clients, they are really holding the values of bodily autonomy, a anti-racist lens, and a commitment to supporting people's right to have a child, right to parent that child free of state and community violence, and their right to not have a child as they think about family planning post birth, if they have decided to birth. And that the results show the numerous complex dynamics Black healthcare providers encounter in their work, and the specialized knowledge they use to effectively deliver culturally specific care. So as Black healthcare providers are working with Black people, They are both having a consciousness around the ways Black birthing people may be vulnerable in healthcare settings, the ways that high-risk pregnancies and high-risk symptoms may present themselves within Black people, the ways that some of the kind of education that Black healthcare, that Black birthing people may need to help them have successful pregnancies, which is very different than kind of a universal lens of just everybody's going to be okay when they are pregnant and having children. What I do think is that a lot of the information that Healthy Birth Initiative offers its birthing clients is information that really should be readily available to everyone, considering the realities of reproductive oppression and the vulnerability of people in birth and in the first year of a child's life. Yeah. So to give a little bit more detail around shared lived, I'm not gonna go into it too much, but I want to highlight the quote from an HBI staff around the shared lived experience and parallel process between providers and clients. And an HBI staff member said, there's this heaviness all the time, whether it's just going to the store or being in the work environment or even with your home and your family. We look like the people we're actually serving. So we experience what they experience. We have firsthand knowledge of it. Most of the stuff we do and teach is kind of what we've learned throughout the days of being here or in our own lives. That racism is a chronic factor in Black people's lives, and Black women experience racism in multiple forms and in multiple domains of life. Participants describe the overt and subtle forms of racism they encounter in their communities, healthcare systems, and the workplace. This challenges the false notion of separateness between clients and healthcare providers. And their expertise comes from being both healthcare providers, their practice with clients, and being Black women. So they have both academic knowledge, skill knowledge from the practice of their work, and insider knowledge from living. That providers are not immune to racism-related stress. You're dealing with your own racism going into a home visit, and then now that client is dumping their stuff on you. And it's like, okay, well, I came in here with my own baggage, and now I have to carry your baggage out of here. It makes it difficult to even be present sometimes because it's a lot. It's a lot to carry around. Participants, HBI client, and that was from that it says a client, but it's actually not a client. That was from a staff member. They talked about how they love what they do and they love working in a predominantly Black environment. That it makes it easier to handle the stresses of both things that they experience at work, things that are happening in the world, and things that are happening with their clients. During the time of our interviews, this focus group was in 2019. In this, at this time, you have rising racial tensions, and we're in the Trump era, and you know, they were talking about concerns they had for their own children and experiences that they were having in the workplace and the stress that they were encountering. That community knowledge expedites trust. HBI staff said the fact that we look like them, we're able to get all kinds of information. Sometimes clients just need to purge and to release some of that stress that they're feeling. That in and of itself is freeing up space for them to cope. They might not have ever told anybody, or certainly not a care provider, half the stuff they tell us. Shared identities and experiences in the broader community help providers gain trust and legitimacy with clients. People want people to look, they want to work with people who look like them. They want to see themselves reflected in their healthcare settings. Again, I talked about navigating multiple shifting gazes, and that HBI staff said our families are in this program. I have family members in this program, so I hear it and I see it, and I go through it myself. And when you leave HBI, you step out of this world and go to the rest of the health department. It's that white world. So then we have to put on our other hat to be able to engage in a way that they deem appropriate. Another staff said, I would like a systems change, that when they look at us, that they don't see us as that program that's going to get funding just because they're a Black program, as if they don't know the health disparities we have. We're getting it because our babies are dying. Our women are dying. There's a toll that comes with code switching, and it is challenging to continually prove the necessity for the work that they do in a scarcity environment. And that becomes even more pertinent now as there's different budget cuts and whatnot. And, you know, I think what's great about HBI's work is it's having positive outcomes. What's challenging is that the positive outcomes more speak to how we should be delivering healthcare, not that we don't need HBI. We desperately need HBI, and this is how we need to be funding maternal health care. Their work centers reproductive justice and community care. A staff member said, a lot of times we're put as just another home visiting program, but we're not just another home visiting program. We're affecting policy change. We're affecting for clients. We're advocating for clients. A staff member said, when you go to the regular primary care provider, it's about what they want for you. Whereas when you work with us, it's about what you want for yourself, your goals, and how we're going to work with you and help you achieve those goals. Because it's about you. It's not about what I want. So the implications for this work: in providing care that is racially congruent, relationship-based, and connected to the daily lived context of clients' lives, HBI providers interrupt medical mistrust and racism that contributes to Black pregnant people's invisibility in healthcare. Health workers act as a buffer or protective factor for clients from racism and other harms in healthcare, and health workers feel the personal and professional implications of this. The care is centered in relationship building, it is community-based, and it is collective. And health workers feel the compounding nature of racism-related stress. So some real kind of recommendations around this work are self-care, community care, and professional support is vital for Black healthcare workers serving Black people. And that as public health departments and community and hospitals and community care organizations are thinking about this, what it means to support Black birth professionals to serve Black clients, working with them around self-care, providing resources for that, and professional development is critical. Culturally specific work needs funding. And it is for employers to value lived experience and pay for it, included in the job description as knowledge, and that is knowledge that should be remunerated. That culturally responsive models are not individualistic. They are collectivist, they are relational and community-centered. And for Black people, holistic pregnancy and parenting supports often go beyond the nuclear family, and effective interventions need to support a variety of actors. Education is needed to create and support the pathway for Black, Indigenous, people of color health professionals, and that professional development for this workforce is critical. And that is the end of my talk. So thank you so much.